Welcome.
Thanks, Jeff, and I'm happy to take some questions. It's a really special night for a couple reasons. First time I have ever been asked to come to a meeting between an insurer and providers about payment rates. And the payment rates have been increased. That is a pretty special night, and I think that's great. And I really think that Jeff and the FamilyCare team deserve those applause. It's also a pretty special night for a second reason. As we're here in Washington, D.C., the president is making his State of the Union address and actually asked the governor to go, and the governor is sitting with Michelle Obama tonight in her box, and that really is in recognition of the work we, and I mean we, all of us in this room and all of us in this state are doing to change how we deliver care in the Oregon Health Plan and how we as a state are really going to address the challenges ahead of us, how we're going to improve quality, how we're going to improve outcomes, how we're going to control costs. And so it's a pretty special night, and I think that really relates to what was just announced here tonight. I think that I'm a primary care doc, and to me, what we're doing around healthcare transformation in this state is really, the foundation is around primary care. It's about good primary care, it's about care coordination, it's about prevention, and it's about beginning to pay for things differently, recognizing the value that you all bring, and having discussions like you're having tonight, figuring all of that out. So I'm really happy to be here just to say thank you. To say thank you to FamilyCare for, I think, recognizing the value of primary care. Thank you for not dragging me into a dispute about payment. And mostly, thank you to everybody in the room for what you do every day to help make what we're doing here in this state a success. It's really about, you're where the rubber meets the road. It really is about those people, providers and patients, and how we all work together. So I want to say thank you. I'm happy to actually answer a couple questions to Anna Jimenez's question. When we add 200,000 people onto the health plan, if that happens in 2014, we've got to work that through the legislative process. But I think, as many of you know, under the Affordable Care Act, there is an opportunity for states to expand their Medicaid programs to cover everybody under 138% of poverty. That in this state would add about, in the next year and a half, about 180,000 low-income adults to the Oregon Health Plan. And over the next about 2.5 to 3 years, we're going to get close to about 250,000 people who are desperately in need of health care. And yes, we're going to help enroll those people in a couple of ways. One, there'll be what are called navigators available for individuals to help them sign up for coverage, because there isn't going to just be coverage in Medicaid. Individuals above 138% of poverty are going to be eligible for the insurance exchange. And we're setting up a system pretty unique here in Oregon, unlike many other states, of having a single point of entry so that individuals can come to one place and find out whether or not they're eligible for the Oregon Health Plan and get signed up for the Oregon Health Plan, or they may be eligible for the insurance exchange and be able to choose a plan and be enrolled that way too. And that'll happen in a number of ways. There's going to be a website where people can go to, anybody, and you'll put in your information, and you'll either be determined eligible for Oregon Health Plan or for the insurance exchange. We hope a lot of people go to that website. It's going to be easy to use, but if you don't have a computer or you don't want to use a website, there's going to be a 24/7 customer service line where individuals can call up and provide the same information and get signed up. And then in addition, there'll be navigators to help individuals individually who don't want to talk on a phone, don't want to be on a computer, and they'll be available to clinics and to others. So I think we're developing some pretty good plans. I think it's going to test all of us. It's going to test us on administratively how we get people in. It's going to test all of us about the capacity we have in the system to take care of people. But I think in the end, it's going to improve a whole lot of people's lives in this state, reduce the cost shift on our businesses, and I think be a tremendous benefit. And we're going to have to all take the spirit we have tonight forward in terms of making that work. It's going to take all of us. So I'm happy to take a question or two or dart out. Yeah? The three ways that determination gets met. The first is when people sign up for the Oregon Health Plan, they get a choice. And people get a choice of what plan they would like to be on. People get some information. That will actually get better when we have the website I was talking about. It'll be much more robust and a much better ability to provide information. So first is choice. And about little under half of people who come onto the Oregon Health Plan actually choose a health plan. If people don't make a choice, then we go to the second method, which is we look at people's history. And if they have been on the Oregon Health Plan 4 months ago and were part of a plan, we will assign them to the plan they have had some history with. The third thing is then if they haven't made a choice and they have had no history or recent history, then they're randomly assigned to the plans in the area. Robin.
Bruce, just an update, 'cause I'm not sure where we stand now. Where are we with undocumented children? Are they covered? Are they eligible to be covered, or are they not?
Both adults and kids that are non-citizens and are not eligible for Medicaid. So that's one of the holes as we go to 2014, and we expand coverage both on the insurance exchange and in Medicaid. There's still going to be we estimate about 5% of the population that won't have health care coverage. And that's going to be a couple different groups. One is going to be non-citizens who by federal law aren't eligible for either the insurance exchange or for Medicaid. And the other are going to be individuals who just choose to not participate, either to self-insure, don't want to sign up, et cetera. But part of federal law is that both Medicaid and the exchange are not eligible for non-citizens. Okay. Well, thanks, and thanks to Jeff and to FamilyCare and to all of you.
I would say one other thing. Bruce is always introduced as the director of the Oregon Health Authority. You have to understand that he has gotten very little sleep in the last 4 years, and including tonight. And so he's not just another bureaucrat that we happen to waste our state money on. He's a pretty important administrator for the state of Oregon that we waste. No, I didn't mean that. No, and frankly, we wouldn't have going on today the new CCOs and all of that without his effort, and so he deserves an awful lot of our thanks for all of his efforts. And with that, we are done. It's only 7:30. 37, I think. But I hope you've had a good evening. I hope you have a good rest of the day. We will keep having meetings like this and make them probably a little less formal, but a lot more interactive, because we do want to hear from you. We do want to hear what the problems are, and sometimes when you sit in a large group, someone says something that spurs you to think of something else. And the other thing is, we'd like you to take a moment to get to know each other, because this is a network that, you know, we hope works together. So, Karen, did you have a comment?
When this event was announced several weeks ago for the board, I was just delighted to know that this is what was going to happen. I've been affiliated with FamilyCare and the board for many years now, and so is our vice chair, and so is Dr. Robin. And we've always known from the beginning that primary care docs make a difference in healthcare. And that's been our stand, and the board has stood behind all the efforts that the staff and Jeff in particular have taken. And so it is exciting to see so many of you here this evening, and that you are excited about serving this particular group of folks in Oregon, and that you make a difference in their lives, and you make a difference for us. So thank you very much.